Hello, everyone. You are welcome to another broadcast of Sex in the City, the only talk show, the only podcast on the airwaves that talks about sex. Everything about sex. Nothing less, nothing more. We are talking about sex today, and you are welcome to Sex in the City. Hallelujah. So I want you to just prompt your friend, prompt your partner, prompt that sex girl that you have been using, prompt that guy that you have been going to visit and doing a washing. Prompt them and tell them that Sex in the City is live. They need to listen to this so that the two of you can be safe out there doing all your things. Yeah. And if you're a youth leader, you're a student leader, I just want you to share this broadcast in your WhatsApp group, on your timeline, on your status, because we are going to talk about genital warts. Genital warts. I'm telling you the truth. Genital warts. We are going to talk about it. Very serious thing. Very, very serious. You can easily catch it. It is highly contagious, and our doctor would talk about it for us. And so without much ado, I just want to invite and welcome our dear celebrity Dr. Susie to the screen so that she share more light on genital warts. Hello, Dr. Susie. How are you doing?
Yeah, I'm very good, very good.
Wow,
Mr. Curtin, I'm so good. I'm doing very well.
We thank God. We thank God. So, Dr. Susie, what are we talking about today?
So today we are talking about genital warts.
Okay.
Yes. And the genital warts, as you can all see very soon, or you'll be seeing very soon with the pictures I'll be showing, are just growths, okay, that appears on the skin of the genitals. When I talk of the genitals, I am referring to the male and female, which could be the penis, it could be the vagina, it could be the urethra, it could be around your cervix, it can even be around your anus or your anal region. Okay, so they are growths, and these growths are flat. Some of them are raised, some of them are hanging, or we call them pendiculated, and they look just like cauliflower or broccoli. If you are a lover of vegetables, you see the way the cauliflower is designed, the way it is lumpy and bumpy. That is how the genital warts look like. So I'll be showing you a picture briefly to just have an idea in your mind so that you will not be having any picture that is ambiguous in your mind, okay? And we want to, again, sensitize you that those pictures are, viewer discretion is advised because they are very sensitive pictures. But, you know, in as much as it is sensitive, this is what some of us see on daily basis. This is what the pictures I'm going to show you right now are not pictures that are far from what I see in my STI clinic on daily basis. So as you can see the penis, okay? And the penis has the genital warts on it. You can see it very, 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 very distinct, okay? And it is very clear because this penis is a fair penis. Imagine you are dealing with a black penis, a dark penis. These growths can be on it, and you may not even know. You may not even know. You may not even know. And then you look at the female also. So you can also see it inside on the vulva. Some of them are inside the vagina. So this is how genital warts look like. Genital warts look like. Okay. So I hope you have this picture in your mind, so that in case you have anything like this going on, you will quickly alert us. All right.
Thank you very much, Dr. Susie. So genital wart. Wow, those are serious pictures.
Yes.
Wow.
Yes.
Very, very serious.
Yeah, very serious.
So how would you identify such a thing? Is it that any growth on any penis is a suspect? Or there are certain characteristics you need to look out for?
Yeah, these are the characteristics I said, that it looks like cauliflower, like I showed in the pictures, okay? So that's why we are showing you this picture, so that when you see something like that, you can know that, oh, this is it, and you take a quick action. And moreover, if you have any growth on your genitals, your penis, and you cannot differentiate, or you don't know what it is, just seek help. Just contact us and let's have a look at it and see what exactly it is, and then we'll be able to take it from there.
Guys, boys, please don't go and chop anything that has things on it. Please, I beg you. Those of us who like light off chopping. Guys, please, I beg you. Guys and girls, please, from today going, before you do the thing, make sure you on the light or use your phone torchlight and examine the penis and the vagina to make sure that there is no.
Yes, there is something I've been saying that look before you do.
Look before you do.
Yes, look do. I remember because of that they named me on one of the conferences look do. So it means that look before you do.
Look before you do.
Yes, look at whatever that is entering you before you accept it. Okay, you have every right and liberty to examine left and right to know what exactly you are dealing with. But as you have said, regardless, we'll be looking at a few of them. There are some of the genital warts that are very hidden. Okay, they are inside the penis. We call them meatal warts. Unless you open up the penis to see inside, you will never know. You will never know that there's genital warts there. So you can even look, you can even examine, you can do everything. But if you are not able to open up, of which, I mean, it doesn't cross the mind of anybody to do that, especially in quick heated moments when you just want to penetrate fast and come out.
You have just reminded me of a song that was in the, I think, 90s or the 20s by Obrafo. Love, life, stop, is.
Yeah.
Okay, so
yeah.
I've forgotten all the songs.
Yes.
Anyway, this tells us that dangerous sexual behaviors are actually dangerous.
Yes.
Or some sexual behaviors are very dangerous for us.
Yes.
For example, orgies and these gala and so on and so forth. These are dangerous things because in those scenarios, you don't really know what is going on.
Yeah, you don't really know what is going on. Yes, exactly.
And also drinking can impair your judgment, such that you will not even have the presence
to even
of mind
look
to
at
examine
and know what you are going into. Yes, we call them risky sexual behaviors. So, like you said, if you are drunk, it clouds your judgment to be able to make very good sexual decisions. If you are doing a gala, yes, it's a very good scenario. You will not be able to examine everybody and see what is going on. Sex and parties, quickies. Maybe you meet someone in the seat in a club, and then you just go in, or nightclub, stand on. I mean, a whole lot. So yes, that's
dangerous sexual behaviors.
Yeah, these are really things that you can get if you have risky sexual behaviors.
And interestingly, these things are very common among the youth and the students.
Yes.
Very, very common among the students. I this week you attended a conference at Ghana Telecom.
Yes.
Okay.
So we had a conference with the Ghana Telecom University as part of their SRC Week celebrations. They invited us as panelists to talk to the youth. The team was building a game changers, and we had seasoned speakers. Okay, they are very, very seasoned speakers. I keep on saying that I was the only one female among the male, but they were very good. They really handled me with care, and I enjoyed their presence and their company. There were a lot of people that were there. Giovanni was there, Mochuman was there, Mr. Somani was there, DJ GC was there. I mean, a lot of seasoned men that are really impacting our generation, and I think the students have been really blessed, and really applaud the student body for bringing up such a very good initiative.
And you were the only woman.
Yes, and as part of it, we brought our sex into board.
We brought our sex.
Yes.
Wow.
Yes.
So if you're a student body and you are watching us and you want to book Dr. Susie, you want to have a time with Dr. Susie with your student or your church, you can go to SHAP Clinic and book a consultation. It's actually free. It's free of charge. And then when she calls you, just speak to her, invite her to the program. She'll be there at no cost to you. And this is a pro bono thing that we are doing for now. And we are running a free promo for now. So take advantage of this free promo now before she starts charging for the consultation. Okay? Yeah. So please get all your problems solved. Now, we were talking about genital warts.
Yes, genital warts.
You have introduced us to it and you have shown us some pictures.
Yes.
My next question is, what are the causes of genital warts?
So genital warts is it's caused by one virus. I'm sure you are all familiar with the HPV, which is a human papillomavirus, because of its implication in cervical cancer. So HPV or human papillomavirus, they are just a group of viruses. We have different types. And some of the types are the 16 and 8 and causes cervical cancer. But and so it is that HPV, another strain or group, that causes the genital warts. So it is a viral infection that is acquired through a sexual contact, okay, unprotected sexual intercourse with somebody who is infected. So either a sexual intercourse, anal intercourse, whether it's an oral intercourse through the mouth, whether it is a vaginal intercourse. These are ways and means that you can get your HPV transmitted to you sexually. And then you'll be able to have the genital warts we are talking about. So like I said, before you continue, I showed a picture earlier on. Again, viewer discretion is advised. So you can see this is just a continuation. Okay, if you can see my slide very well, I was talking about the one around the anus, so you can see it. This is the genital wart around the anus, and then you can see the genital warts in the vagina. Again, this genital warts in the vagina, you know, these are gross. What you are seeing here did not just wake up one day and then started as a lot of growth. It started as one, okay? It's highly contagious and it spreads. So it starts at one growth, then it builds up and builds up. So the vaginal one like this, if you do not take care of it early, it can grow to the extent that it can cover the entire vaginal orifice. Then you can see, I'm sure we are all familiar with this structure that is right here. This is the male penis. Look at where this genital wart is. Just look at where it is. Just look at where this genital wart is. If you're not careful, and especially in a dark skin, you saw the first skin, you may never know that this is a genital wart. And then the skin will wrap against your skin and you will get infected. So please be cautious. Please be cautious.
So it's not only when the penis enter the vagina that you can get it. Even if it rubs the skin.
Yes. Yes. It's contagious. It's contagious. So if it rubs around, during sexual activity, there are a lot of things that happen, and it's not just the penetration. Okay, so wow. Yes, so and even as the penetration is going on, apart from the penis in the vagina, you have skin and skin contact that wraps, okay, that wraps each other. So if you have the genital warts around like the base of the penis, like as I showed earlier on, you have it. You have it. It's highly contagious.
Wow.
It's highly contagious.
Charlie.
It's highly contagious to the extent that even me as a caregiver, if I'm taking care of you and you have a genital wart, I'm very careful because a little a little mistake on my part, I can infect myself.
Wow.
Yes, I can maybe mannerism, and then I'm rubbing my ear before I realize I'll get that genital wart in my ears.
Hey.
Yes, in your nose. I mean, it's contagious.
Very contagious.
Yes, it's very contagious.
Wow. Yes. Wow. So please, those who have been giving blowjobs, I beg you today.
Imagine genital warts inside your mouth.
Hey, mercy. Mercy, please, I beg you, from today we have stopped it. Okay, you agree with me? From today, no blowjobs, no blowjobs. Okay. let's continue. So, you have just described the mode of transmission. That's
yes.
Skin to skin contact.
Yes.
Meaning that any part of our skin that come into contact with it.
That has because the picture that I showed, the genital warts can be anywhere along the tracts of the penis or the vagina. So like I said, during sexual intercourse, it wraps. So if you have the genital wart around the places of the penis that are not even penetrating, so far as it touches the skin around, you will have it.
Yes.
Yes.
You would have it.
Yes.
Is it painful? Is it itchy? How does it feel?
Yes.
What are the symptoms?
Okay. All right. So the symptoms for genital warts, what happens is the genital warts are not painful. They are painless, okay? But they can be very itchy. And then when it comes to the women, it can come with vaginal discharges or sometimes bleeding after sex because it's a growth. So as the sex is going on, they can scrape and you can have bleeding after sex. Do you understand? So those are the symptoms that comes across with it. So apart from the itching, apart from the discharges that comes with it, even if it is painless, sometimes it can get infected. Okay, when it gets infected, then you have the pain. But aside all these symptoms, it makes it very uncomfortable. It is very, very uncomfortable to know that a smooth penis that you were born with, very nice shiny penis that you were born with, or vagina that you were born with, all of a sudden is full of so many growths like we saw in the other this picture. Yes. I'll look for it and then show you again, so that as you are going, you are greatly advised. Oh, I'm sure. Yes. So imagine a smooth penis, very nice penis, then all of a sudden all these growths are on it. Apart from the symptoms I have outlined, you yourself, you will not be comfortable. And sometimes it can even lead to self-esteem, low self-esteem. It can lead to depression and all that. Okay? Yes.
Wow.
Yes.
That's very, very, very serious.
Yes.
Wow. Okay, so Charlie. Why is it bread, Charlie?
Yeah.
Oh, Charlie. Charlie, Anyway, so how do we treat this thing?
Yes, so when you
serious.
Yes, every day I've been saying that is why SHAP Clinic, we are there for you. When you have this, what happened is that we do a very careful history taking for you. Okay, we make sure that we exhaust your history, your sexual history, a whole lot. Then we do an examination. We examine you, examine the penis to be sure that what we are dealing with is really what, okay? And then also we, if it is the female, as part of the treatment, what we do is that we make sure we screen you for pap smear, because I said earlier on that the HPV there are a lot of strains or types. And one of the types, like 16 and 18, also causes cervical cancer. So if you are a female and you are coming to me with genital warts, my mind is broad. If you are able to get genital warts, then it is possible that you have the virus or the strain that will cause cervical cancer. So as part of the treatment, we make sure that we let you do a pap smear to be sure that you don't have cervical cancer.
So, doctor, before you continue, this means that at SHAP Clinic, we do comprehensive treatment.
Very detailed, comprehensive treatment.
And this means that when we see these kind of things, it's good we come to you guys instead of just going to the drugstore for medicine.
Yes, it's very, very good. You see a professional like us who are dedicated to making sure, because when you go to the drugstore, I mean, they just give you anything. I have seen a lot of people with this condition, okay? So in line with what I was saying earlier, the treatment, apart from the examination, we have medications, okay, that we give. The medications, I will not go into details. The medications, some of them are applied on it, and then it's able to take off the growth, okay? And then we have other extended medications that comes to what we call cryosurgery. We've not exhausted that one here in the country, whereby laser to shrink. Then when it becomes very extensive, you have a surgical intervention. Okay, we have surgical intervention to remove this genital warts. And removal can be very painful. If it is very, very extensive, it can leave your anal region or your vagina a lot of wound, because it is very junk, and it grows very, 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 very deep. Very, very, very deep. So it is very important that you take notes of this genital warts. Immediately you see that there is a growth like that, quickly seek professional help. Quickly seek professional help, so that we'll be able to start treating it very, very early. And I want to say that it has no cure. Okay, it has no cure. We just manage the symptoms. So if you do not come very early, and the treatment is very, very expensive, very, very exhaustive, you need to be dedicated to it. So if you don't come very early, when you have about 1 or 2 growths, for us to just use the medication on it and then remove it, and you leave it till the whole penis is covered with it, the treatment is very, very, very difficult. Very, very difficult.
Okay. You have talked about treatment, 2 types of treatment, surgical and...
We have different modalities of the treatments, okay? We have different modalities. So we have the medical treatment, that we have medications that we put. We have different variety. That one is for we there. When you come to us, we'll exhaust it for you. So we have some we call the cryotherapy. We have some we call the electrosurgery. We have the surgical one as well. Okay. So these are the modalities. But currently, what we use mostly in Ghana is the chemical treatment, which is the medical treatment, and then the surgical removal.
Okay. Guys, so Dr. Susie, your celebrity doctor, is doing a free promo on SAP Clinic. Please go there, book an appointment with her.
Yes.
It's free of charge. Let her know what is going on, and then she will help you go forward. As soon as you see something on your penis, I beg you, whether it's a pimples, you don't know what it, please, as soon as you see it, raise an alarm. Just book an appointment. Let her look at it, because you don't know. Because you don't know what is happening. Okay, guys, please, let's do that. Okay, so Dr. Susie, before we go, I just want to say, what are some of the complications and how do you prevent it?
Yes. Okay, so the complications. One of the complications that I said earlier is that this growth, if it's not attended to, okay, it can grow to the extent that it can cover the entire vaginal orifices. So you can imagine the entire vagina covered. It means that you may not be able to even deliver or give birth naturally, unless maybe a CS have to be done for you if you get pregnant. And even penetration to even get pregnant is impaired. Apart from that, also, I said earlier on that you have other strains of it that causes that causes cervical cancer. So your risk of getting cervical cancer is also very, very, very high. Okay, and then also another thing that can also happen is that you self-esteem. It can lower your self-esteem. Imagine having all this down there. You are shy to even have intimacy. You are shy to even go in for marriage or anything. So you become low self-esteem. If you're not careful, depression will set in, and then a lot of other complications will occur.
Okay, guys, thank you very much for being with us. We are bringing our show to an end. This has been a very, very, very interesting show and very informative. I've learned a lot.
Yes.
Genital warts.
Yes.
I'm not sure I'll be eating any cauliflower.
Cauliflower, you will.
Cauliflower.
You will.
Anytime.
You will. You will. You will. You will. You will.
Okay.
Anytime you take a cauliflower, let it not prevent you from eating it, but just let it remind you that genital wart is there.
Real.
Most of people know of gonorrhea. A lot of people do not know of genital warts, but it's there.
Wow.
And a lot of people, I see genital warts daily basis. I see genital warts. So it is real and it's a sexual transmitted infection. So please be cautious.
Okay. Thank you very much, doctor.
Thank you.
And please, as I said, just go to SHAP Clinic right now and book an appointment with doctor. Now, subscribe to our social media channel. We are on TikTok, we are on Instagram, we are on Facebook, and we are on YouTube. So subscribe to our YouTube channel, follow our Facebook page, and then we would have a good time. You will get to learn a lot. And if you're a church or an organization and you want Dr. Susie to come and talk more about these things, and maybe do a general screening for you guys. Maybe you're organizing a program.
Yes.
A year group program, you want general screening, you want a talk on sexual health, and then a general screening. Just go book an appointment with her on the site, and then you will get to speak to her. And Dr. Susie, before we go, your last words.
Okay, so my last word, I mean, you have said it all. Please subscribe to all our social media handles, our YouTube, our TikTok, Instagram, Facebook. Like, share, and I want you to take your sexual health very, very serious. Very serious. We are in a dispensation where information and care is available. Do not feel shy. If you are listening to me right now, or you listen to this video later on, and you have any challenge with your sex and reproductive health, please don't sit on it. Schedule an appointment. Let's get talking. We are here for you. Thank you.
Thank you so much, Dr. Sudi. Guys, this is how far we'll go. Thank you so much. Bye-bye.
Bye.
And see you again.